Rainier Avenue Radio.
This is Tyrone with God Is and the inspiration of gospel music also on Rainier Avenue Radio App. We give out free food each and every Saturday from 11 to 2. And so we want you to come on out and support us. We love on your community. And we also have a fish fry once a month. We want to raise funds, put back into the community. And so come on, support us. We need your love. And also, if you want to be connected with us, go to Rainier Avenue Radio World, to the website, Facebook, Instagram, and God Is. And as God Is got a website, we need your help, community. So come on out and get your free food each and every Saturday it is. And so we asking for donation, whatever you feel to give from your heart to the mind. And as we doing it right here for you, go to our website and touch love and give back. And so come on by 810 23rd Avenue, Rainier Avenue Radio World, your community radio station and inspiration of all the things we do in your community.
Tune in to Real Estate and Money every Tuesday afternoon from 2:30 to 3 here on Rainier Avenue Radio World. Join your hosts Violetta Strash with John L. Scott Kent North and Tina Lombard with Guaranteed Rate Affinity. They'll help you navigate the waters of our volatile real estate market and offer you some guidance on how to make your hard-earned money work to make your dreams come true. Learn about current trends, get tips on financial matters, and have fun, interactive discussions about your home inside and out. That's Real Estate and Money.
Are you a cultural producer who has been impacted by the pandemic? For Culture is offering relief grants between $1,000 and $12,000 to cover your COVID-related losses and help you move forward with your creative work. If you're creating cultural experiences in any discipline at any stage of your career, you should apply. Exhibit designers, museum educators, archivists, restoration professionals, curators, archaeologists, history researchers, artists, and more. That means you. Not sure if you're a fit? Give them a call and they'll talk you through it. The deadline to apply is Wednesday, February 2nd. Head to forculture.org/recovery to get information on virtual group workshops, application support, language translation, and more. That's forculture.org/recovery.
You're listening to Rainier Avenue Radio World. Check us out on social media. Facebook and Instagram, Rainier Avenue Radio World, and on Twitter at Rainier Ave Radio.
Welcome to Rainier Avenue Radio World. It's me, your host, Tony B. And of course, this is our special Impacts of the Coronavirus on South Seattle and surrounding community show that we do every Friday from 1 o'clock to 3 o'clock to provide you with information and also share with you what's going on in other communities. So you know that you're not alone as this is going on. And this, of course, means that we're dealing with a landscape that is constantly changing when it comes to coronavirus. Wow, can you believe it's March 2020, the 13th, at least here, that's when we started doing this programming. And here we are almost into February of 2022. And are we any closer to seeing the end of this, or is this an adjustment that we have to make moving forward in the way that we function as people, as a society? My guest is going to be Dr. James Lewis. We're going to talk about COVID tests. There's been a lot of information out there about testing. Make sure you get a test. Well, what does that mean? And when you're saying to yourself, well, what are these tests and what do they do? And what am I going to, and do I have a decision in potentially which test may be right for me? Well, we're going to answer those questions. What are the differences in the various tests? What does the test look for? Everything you need to know about COVID tests. I guess Dr. James Lewis, who is the medical epidemiologist. And Right before I bring him on, I think I just want to remind everyone that tonight we'll be broadcasting from O'Day High School. O'Day will be taking on Seattle Prep in Metro League basketball. And that'll be tonight. And then starting next Tuesday, it's February 1st, which means it's Black History Month. Rainier Avenue Radio will be celebrating Black History Month. Now, we do this all the time anyway, year round. But we're going to celebrate February Black History Month all month long. All month. We are going to try and provide you with a comprehensive, holistic experience talking about the Black experience, what that means. And there are so many different facets to it. It's hard to just say, oh, let's do this all in one day. Yes, you can hyper-focus. So we're going to be taking a look at everything that it means to be Black. What does that mean? We'll be taking a look at Blacks in science, Blacks in education, Blacks in technology, Blacks in sports, Black health. The highlight of this will be our Tulsa Black Wall Street exhibit. That will be here the 25th, the 26th, the 27th. If you're unfamiliar with Black Wall Street and what they used to call the race riot that followed, but it wasn't a race riot, it was a massacre. We've got some memorabilia for you. Again, we're going to have an exhibit, specifically the Women of Black Wall Street exhibit that we'll be showing you. Just a whole lot. All right. And this was just a sneak preview. But starting on Tuesday, it's going to be Blacks in Comedy. And we'll be kicking off the month with Swing One and Nate Jackson and Tawana, who will be joining us from 7 o'clock to 8 o'clock. They'll talk about the legacy of Black comics, what they are going through and have been through and foresee in the future for Black comedy, the impact that Black comedians have had on society. And they're also each of them are going to do a brief set as well. So get ready to laugh. That's 7 o'clock on Tuesday. Blacks in Comedy. And we'll just be kicking this thing off for the entire month. But in the meantime, I would like to bring on Dr. James Lewis. Dr. Lewis, welcome to the program. How you doing?
Doing well. Thanks for having me, and just wanted to say thanks for all your work getting information out into the community, to your community. Much appreciated throughout the whole pandemic.
Thank you. Oh, my when the camera changed, I gotta fix my camera, I guess. Let's see. All right, there we go. That's better. Well, good to see you, Dr. Lewis. And for anyone who may be unfamiliar, I'm not going to read your bio. I would prefer, again, just to have you just give us a short or long description about the work that you do, what an epidemiologist does, and again, why you decided that this was going to be the career path for you.
Sure, thanks. I went to medical school back in Arkansas, where I'm from, and then did an internal medicine residency.
Where in Arkansas are you from?
Little Rock.
Little Rock. I was in Little Rock about 9 months ago.
Oh yeah.
Yeah.
Wow. What for?
Actually, I was down there searching family roots and visiting family members, and went to Pine Bluff, and you may be familiar with a little town called Rison.
I'm not familiar with Rison.
About 20 minutes outside of Pine Bluff. And
Okay.
of course, I stopped at the University of Pine Bluff, Arkansas,
Great.
as well. Yeah. Anyway, This is about you.
Yeah. So I went to St. Louis then for residency and did internal medicine. So kind of primary care for adults with complicated, a lot of different medical problems, essentially. So kind of like a family practitioner, but for focusing on older people, not geriatric people, but just adults with multiple medical problems. And then specialized in infectious disease out in North Carolina. And then while I was there, realized I was interested in public health and population health. And so looked into what that would mean, and pursued a master's in epidemiology, and did a little bit of extra training in around public health, and then got a job at the State Department of Public Health in North Carolina. And so basically, what an epidemiologist is kind of like a doctor for larger populations. So they look at issues on a population level and try to monitor those and determine if there are interventions we can do, like mask wearing, say, or even seatbelts, to prevent things we're seeing that are negatively impacting large numbers of people in a population.
All right. Why did you choose to do this?
I did, during all my training, I did direct patient care, taking care of individual patients. And it was definitely rewarding. But I felt like I could have a bigger impact for me. It's not necessarily true for everyone, but for me, I felt like I could have a bigger impact in my my talents, my personality would be better put to use looking at things at a population level as opposed to individual level. And so that's what I did.
Yeah. And then the other part about it is, diseases.
Yes.
Have you all, when you were a little kid, were you interested in it? Did you go, wait a minute, what is this? How does this work? What got you interested in this particular field of study?
Yeah, my parents were both doctors, so I was interested in health professions from a very young age. And then I remember I think it was 8th or 9th grade, and we first learned about parasites, different parasite infections in biology class, and I just found that fascinating, and I wanted to learn more about it. And ever since then, I've had a fascination with infectious diseases and knew that's what I wanted to do. So. First thing I wanted to be when I was a kid was an archaeologist, though. I wanted to dig up dinosaur bones.
Well, cool. I just wanted to at least spend a couple minutes, again, giving people another opportunity to get to know a little bit about you. This is a big issue. Very nuanced, very complex, but at the same time, pretty simple. I'm going to try and not have it get too wonky. But if that's where it needs to go, then that's what it needs to be. And we'll just try and make this a conversation that I can understand as well, so that it's not completely above my pay grade to understand, because, again, this affects everybody. And everyone's just testing. And as you know, there's a lot of noise out there. And there's a lot of misinformation and disinformation. And so I'm going to start this off with a really, really broad question. And I'm going to narrow it down as much as I can. And you correct me if I'm wrong here. So when we're talking about COVID testing, my understanding is that there are basically two kinds of tests: diagnostic tests and antibody tests. And that's already getting a little, is that correct? Yeah, I know. I don't know what I'm
not exactly.
Okay.
So there are you're right that there are two main types of tests that people should be primarily concerned about, but then there are a lot of different kind of tests. I would say all tests are essentially diagnostic tests, meaning they're just, you do a test to help you determine if you have some particular disease or not, or something that makes you concerned for some particular disease. So really any medical test you get done is going to help you with some form of diagnosis. And so they would be all, relatively speaking, diagnostic tests.
Okay.
Whenever you're talking about COVID, all of them are looking for COVID, or maybe if you've had COVID in the past. So the antibody test that you referred to, that's just looking to see if you've had COVID in the past, or maybe also you could look at it to see if your vaccine worked, to see if you had an antibody. Like sometimes, just to give another example, with chickenpox, if people don't remember if they had chickenpox or if they got the chickenpox vaccine, we would do an antibody test And if you don't find the antibodies, then you need to get a chickenpox vaccine. But if you do find the antibodies, that means either they got a vaccine before or they had the infection before. It doesn't necessarily mean they have it right now. And that would be the same if you got a COVID antibody test. Is if it was positive, you don't know if you have a COVID infection right now, but you either got a vaccine or you had it before. Maybe you have it right now, depending on what kind of antibody you're looking for. But it doesn't necessarily help you decide if you have it right now. And there's not very many COVID specific antibody tests available right now. And we also don't really understand what type of result is meaningful for different reasons with COVID antibody tests. So I would say that's one that, vast majority of people shouldn't be worried about. And then there are two types of tests, though, that people should worry about. I'll stop there before we move on to those, to see if you have any.
No, I'll jump in with questions, but you go ahead and continue.
Okay. So the two main types that everybody should be thinking about whenever they're thinking about getting a COVID test is a PCR test or a molecular test, sometimes also called a NAT test, NAAT, which stands for.
Okay, I'm gonna a PCR test.
Yeah.
I may regret asking this, but what's a PCR test? Is that an acronym for something that you can help us?
It is. It's an acronym that's not particularly revealing when you spell it out, but it stands for polymerase chain reaction. But basically what that test does, any test like that, amplifies the DNA or the building blocks of the virus. I'm sorry, it's RNA for COVID. So it amplifies that. So you put a little sample of your, from your nose or saliva, from your throat into a tube, and then it mixes up that into a liquid, and then you put that liquid into a machine that then runs a series of chemical reactions that reproduces that viral RNA until there's enough there in that tube that the machine is running this reaction on that it can detect that amplified RNA. And if it doesn't detect it, it means that there was no viral RNA there to begin with, or the building blocks for the virus.
Okay, you keep going now. You said 2 times you PCR, and I just wanted to try and get that out there. Keep going.
Cool. Okay, so in a PCR test, I just want people to know, because a lot of different words are used interchangeably. So PCR, NAT test, which is the NAAT, and that's a nucleic acid amplification test, which is basically just the RNA, so amplifying that building block RNA of the virus. And there are some others, but they all mean the same thing, more or less. And then the second type of test is kind of really the hot topic right now, called antigen tests, also referred to as point of care tests often, or rapid tests. And there are a lot of issues with the different names that we can go into more if you'd like. But essentially, all of these tests, what they do is they look for pieces of a completed virus. So you get infected, the virus gets into your cells, and then it uses your cell's machinery to make more of the completed virus that then gets put out into your bloodstream and then gets out, into your respiratory tract, and you cough it out or breathe it out, and infects other people. So
does that mean it makes us sicker? Is that what it's doing, or does it look at it that way? How is the virus, when it's doing what you just said it did? What does the virus think it's doing?
The virus, well, the primary thing from the virus's standpoint is just to reproduce and make more of itself. A byproduct of that is making us sick. Yeah. Okay. And also what makes us sick is our body fighting it off as well. So when our body fights off an infection, it often causes fever, feeling achy. It can also cause coughing too, and you get inflammation in your airways due to your body's immune system going to that area to fight off the virus. But the primary goal of the virus is just to reproduce and then get out into the environment so it can infect somebody else and continue to reproduce. That's what its primary goal is. But a side effect of that process is to make us sick.
Okay. I interrupted you again.
Oh, okay. And so basically what the antigen test does is it doesn't amplify anything like the PCR test. It just looks for pieces of that virus in the sample that you provide it. And that's why most of them are point of care, or the ones you can get and do at home. You just put the sample on a little strip and give it time, And then it tells you if any pieces of that virus were in that sample that you put in the strip.
Okay. I'm just grouping all these things together because this is how they come at us. We hear about home testing, rapid testing, going to a physician and getting tested, and false negatives from tests. We now hear about athletes who are getting tested and may have been exposed to the virus. Are all these the same test? What? Just kind of help us understand, Dr. Lewis, what's going on here. Is that all the same thing?
So they're all tests for the virus, for COVID. And so, I mean, I guess the bottom line I'd want to get across is that all the tests that are available that you can get from, a physician, from your physician, or, at the public health sponsored testing sites, which can be found on our website. And we'll put the link into the chat that shows where all those testing sites are. Those are good tests. They're all good. And they can be used in slightly different ways, and some can be better in very specific situations. But overall, if you have access to only one type of test, it's a good test and you should use it. But in general, when you talk about getting a test from a physician, that's probably a PCR test.
Mm-hmm.
That's not always true. Our public health clinics, for instance, are starting to get some antigen tests in. And then also long-term care facilities often use antigen tests. But often if somebody's going to urgent care or to the ER, one of our testing sites, one of our high throughput testing sites in the county, those are PCR tests for the most part, vast majority. And then the home tests or the rapid tests are generally almost always antigen tests.
And again, an antigen test does what?
The antigen tests look for completed viruses, so parts of completed viruses. So when your body, gets infected, and then puts RNA into one of your cells, the body then uses that RNA to build a whole virus that can then go on and infect somebody else. That's what the antigen tests are looking for. Whereas the PCR tests are looking for that RNA or that building block that's red to then, it's like the instructions essentially. So it's looking for the instructions that the body then uses to create whole viruses that can go on and infect somebody else. Whereas the antigen tests look for the virus itself.
You're listening to Rainier Avenue Radio World. This is our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. My guest is Dr. James Lewis, epidemiologist. Is there an incubation period or something like that? And I don't know if I'm using that right word, where you may have the virus, but it hasn't started doing the things that it's doing yet, and the test may not be able to recognize it. And then the other part about it is if that's the case, what is this period and how reliable are these tests going to be? If that's the case, you can say, oh, my test was negative. I know I'm negative. So I think you know what I'm trying to say.
I do. Yeah. And you use that word absolutely correctly. There is an incubation period where, if I go to a party, say, and there's a bunch of people around and we're not wearing masks, and somebody there has COVID and I get it from them, the virus gets into my body at that party. There's a period, depending on which variant we're talking about, but if we stick with Omicron here, there's a period of probably somewhere between 36 hours to 5 days on average. Some people will be a little bit longer than that. Before I will be able to test positive on any test. And the PCR tests will become positive hours to up to a few days sooner than the antigen tests. And so you can kind of think of that as like getting a delivery of a piece of furniture. You go get a piece of furniture from IKEA and you bring it home. It's not ready to use. So the virus isn't ready to infect anybody else or be positive on a test until you build it. And so your body has to build those viruses before they're able to be detected or used to infect anybody else.
Is this I guess just a monolithic thing. Do people have to be concerned about, well, this test is right for my body, this test is wrong for my body? Do I have to be concerned about, well, which test is right for me as an individual? Is that a big thing? Is that a real thing? Or everybody's all on the same page here? You take the test, it responds to each of us as humans, and we get basically the same results.
Yeah, well, I don't want to, there may be some people who have strong opinions about which test they should use, but from a purely, but from a, from my standpoint, looking at it just from a population level and from a scientific point of view, no, there's no tests that's going to work better in one individual versus another individual. They work the same in each person, but the PCR tests and the antigen tests work differently, and so can be, one can be slightly preferable in certain situations over others. Like, for instance, if you got exposed and you find out you got exposed to somebody yesterday, and you want to get tested, then you might want to take a PCR, and you want to get tested right away. The best chance you have of it being positive if you get tested within, a couple of days is going to be a PCR test, because that's going to show up earlier than an antigen test. But if you found out you got exposed to somebody 5 or 6 days ago, then an antigen test is going to work more than likely just as well as a PCR test. So it's really a timing issue more so than whether one is better than another on a person basis. And then also you have to take into consideration what's accepted for what you're doing, right? So for instance, in King County, we have a requirement that to get into places like restaurants, you have to either be vaccinated or you have to have a test within a certain period of time.
Right.
I think it's 72 hours. And so if you are unvaccinated and you want to go to that restaurant, you have to actually have had a PCR test within 72 hours. You can't have used the antigen test. So in that person, using a PCR test is preferable, just based on the rules that are present right now.
Okay, so let's clarify that. If you want to fully participate into the world of vaccinated people, this is not a political statement, I'm just saying, the test that you need to be able to show within 72 hours is a PCR test.
For the most part, because that's what's available from healthcare providers. You have to get a test that's administered by a healthcare provider. There may be some exceptions where if you can find a healthcare provider that has access to antigen tests, that might be okay. But primarily all businesses are looking for that PCR test result or the molecular test result.
And so just for clarity purposes, that is not the rapid test or home test, and the rapid test and home test, those are the same thing?
Home tests are a type of rapid test.
Okay.
Yes, sir.
And that is not the test that will give you access to.
Correct.
Yeah. Okay. So if you want to go out to dinner and you take a rapid test and you say, hey, I took a test, and the restaurant says, no, we can't accept this, it's because you need a PCR test.
That's right.
Okay.
And I would just add too, if there's anybody thinking about it, the best way to get to participate is to just get a vaccine and a booster, if that is possible for you.
All right. Before I move on, because I just want to be clear about that, is there anything about that concern that you want to add to that, about which test is the test that will allow you to participate with people who are fully vaccinated or boosted? Is there anything else you want to add to that before I go on to something else?
No, just that I would encourage those folks to get vaccinated and boosted, and then just say, there is a time limit on that. So you can't get a test and expect to participate a week ago. It does have to be within that 72 hours of whatever the activity is that you're wanting to participate in.
Okay. Now, I think I've kind of cleared this up, but I want to make sure that we have a good understanding of this. So we're also hearing a lot of information about some tests, and if they're all the same, I don't quite understand it, being more reliable than other tests. Is that the case, or is that just an individual, your body thing that we're hearing about? Oh, well, this test is far less reliable than this other test. Can you explain what that means and why some tests appear to be more reliable than other tests?
Yeah, so there is truth in this statement. So the antigen tests, like I mentioned, they look for completed pieces of the virus, right? Whereas the PCR tests look for the instruction manual on how to build a virus. And there's a lot more called the RNA, and there's a lot more RNA in your body, and it sticks around for a lot longer in your body, and it's found earlier in your body than the completed pieces of the virus. Mm-hmm. And so the PCR tests, because of that, will test positive earlier in the same person. So if you had me and I got exposed and then and I can be detected on a PCR test 3 days after I get exposed, and then I can test positive on PCR for a long time, including after I'm no longer infectious anymore. So, when you get infected, you're supposed to stay inside and isolate and away from other people for 10 days. Well, you might test on a PCR test positive for 30 days, and they've even shown it up to 100 days, even though you haven't been infectious or dangerous to anybody else past that 10-day mark. And so that test is what they call more sensitive. It's going to pick up a smaller amount of viral information, even beyond whenever you're actually able to transmit the virus to somebody else.
Dr. Lewis, can you believe we're almost out of time? I swear I feel like we just got started. Really quickly, I'm going to ask one question, and then I'm going to give you some space too. So if you decide that you want to go to Canada, or you want to get on an airplane, and they're saying you need a test, what kind of test is required in that instance?
That's a really good question, Tony. You really have to check with the place you're going. For Canada in particular, at least as of a few weeks ago, I haven't looked since then, we're requiring a PCR test specifically. So you would have to get a PCR test for going to Canada, as far as I know. Different countries have different requirements, though. So you would want to check, and usually you can go to the immigration website for whatever country you're wanting to visit, and that should tell you what type of test they're going to require, because you definitely don't want to get there and get caught with the wrong kind of test, because that can be very inconvenient.
So you are going to have to do some due diligence and do some research, because this is not one unilateral thing. There are requirements. I know we don't have enough time to get into why is that the case, folks. I mean, well, why don't you make this easy for Dr. Lewis? First of all, thank you again for coming on and sharing this information. I can't believe the time went by so quickly. Having said that, what would you like to say to people who are listening right now about testing and about concerns folks may have about which test is the right test? How reliable are these tests? Just go ahead and take some time and share whatever you want to share with our listeners and viewers right now about testing.
Yeah, I would say, right now, with as much COVID going around as is going around in the community, all the tests are very good. And there's, a scientific reason for why tests work better when there's a lot of the thing it's looking for around. But that is the case. So all the tests are very good right now. And you should just get access to whatever test you can, because it's really hard to get a test right now. Unfortunately, we're doing everything we can to improve that. And we're actually distributing a lot of at-home tests in South and Southeast King County, where the pandemic has, disproportionately impacted communities over the last 2 years. I'm not saying everybody has great access. We're doing what we can to try and equitably distribute those. in those communities, but the demand is much higher than what we have supply for. So we're trying to help. We've also done everything we can to put, the high throughput drive-through or walk-up testing sites down in South and Southeast King County to give better access. So those are good resources to get tested. But at this point, I would use whatever test you can get access to, and getting tested is going to reduce your risk. If you have a negative test, you can definitely be more confident that you are safe than if you didn't have a test. And then just encourage folks to, the best thing to do, the safest thing to do is to get vaccinated. And now there's more and more information coming out that shows that getting a booster after you're fully vaccinated really increases that safety even more in a substantial way. So would just add that.
I got to sneak one more question in here.
Sure.
There are things that are now part of our day that we didn't think about before. This thing called variants and mutations. Are the mutations and variants, are some of them better at hiding from the test, or can the test identify pretty equally? It doesn't matter whether it's a Omicron or a whatever these other variations are. The test is okay. I can nail this down. Or are the variants, mutations get it better at hiding from the test?
Yeah, so far, so we have to answer this question with every variant that comes. It's certainly possible we could have a variant that would be difficult to detect with some or all tests. That has not been the case so far. So far, all of the variants, including the Omicron virus, are detectable by all of the tests that are available here in the Seattle, King County area. There were a couple of types of tests that had trouble identifying Omicron, but none of our labs use them here. And all of the point-of-care antigen tests appear to be able to identify the Omicron variant. But it's a good point, and definitely something that the experts are looking at every time a new variant comes around to see if the tests can actually pick it up, and if there's differences between different types of tests in its ability to pick up a given variant.
Okay, and I wanted you to be here to talk about that, so I wasn't going to stick you with a bunch of questions about people saying, I can't get a test. Where can I get a test? And why don't we have tests available? And so I'm not going to stick you with that. But yeah, that is also an issue now. And I think the fact that there is a demand is a good thing.
I agree.
Dr. Lewis, thanks. At some point I'll be asking you to come back again.
Happy to.
And just again, thank you for joining me. Thank you for sharing this information. I really feel like this went by way too fast. I felt like we were talking for 5 minutes.
I agree. It was very fast. Well, I'm happy to come back anytime. Thanks for having me.
Okay, and we're 5 minutes over. So thanks again. You're listening to Rainier Avenue Radio .world. It's me, your host, Tony B. This is our special impacts of the coronavirus on South Seattle and surrounding communities. Our guest, Dr. James Lewis. Again, we try to give you everything you need to know about testing. As you can see, it's pretty complex, but at the same time, it's pretty simple. I hope you know a little bit more than you did before you watched this show. If not, go back and watch it again. And share the information. And you know what? Send your questions in to RainierAvenueRadio.world@gmail.com. If you were left with more questions than answers, that's RainierAvenueRadio.world@gmail.com. And we will try to get answers to those particular questions for you. I want to remind everyone again that tonight, a big game in the Metro League, Seattle Prep versus O'Day. I'm kind of putting Daniel on the spot here. I don't know if he's prepared to answer this question, but what are the playoff ramifications, Daniel, really quickly, of this Seattle Prep O'Day basketball game tonight?
Well, Tony, O'Day, Eastside Catholic, and Seattle Prep are all within a half a game of each other, and there's 3 games left. So this one's going to go all the way down to the regular season finale next Friday, no matter who wins.
All right. Three-way Eastside Catholic, Seattle Prep, O'Day, separated by half a game. All right.
Yep.
Okay. So yeah, tune in tonight. We're excited and happy to be able to bring these games to you since there will be no attendance by fans. And then also February 1st, when February 1st begins, we will start broadcasting our Black History Month specials. We're going to be broadcasting Black History Month specials all month long, the entire month. On the 31st of January, we will release a calendar. Make sure we get that up on the website. Again, a comprehensive Black experience overview of why Black History Month is important in sharing the Black experience here. And so we're going to talk about a lot of different things. Some of them you might, like, go, well, wow, is that a uniquely Black thing if you're talking about Blacks in technology? Yes, it is. The Black experience in technology is its own journey. Is that a unique thing when you're speaking about gender roles in the Black community and that discussion? Yeah, that there are a lot of nuanced things that go into those discussions as well. So we're going to try and cover as many of them as we can for Black History Month. Again, tune in, look at that calendar. We're going to cap it all off on the 25th, 26th, and 27th with an exhibit, The Women of Black Wall Street. It's an exhibit from Tulsa's Black Wall Street, which, as you may or may not know, was destroyed. And there was a massacre. It wasn't a race riot. So we're going to share that information from you. We'll have some ancestors, direct ancestry of Black Wall Street. And yeah, just really great stuff coming up. I know we're out of time and we're over time right now. On that note, appreciate everyone tuning in. It's me, Tony B., your host of Rainier Avenue Radio's Impacts of the Coronavirus on South Seattle and surrounding communities. We're going to take you directly into our regular programming. If you're watching on our stream, go ahead and go to the website or to the app or Alexa or a number of other ways that you can also continue to hear the programming that we broadcast on this radio station 24 hours a day, 7 days a week. That's it. That's all the time I have. That's going to do it for the kid. It's me, Tony B., saying, remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.